Hi, this is Dr. Toby, your host on Health and Wellness. Thank you for joining us. We have a tremendous show with the Mississippi Organ Recovery Agency and the Louisiana Organ Procurement Agency. Miss Belinda Lane is going to be representing MORA, Mississippi Organ Recovery Agency, and Miss Leah Lopez is going to be representing the Louisiana Organ Procurement Agency. They're going to be telling us what they do, the benefits of organ transplant, and how you can be a blessing to somebody even after you have died. I want to use the opportunity to invite you to our Holy Ghost night on the last Fridays of every month. We're going to be meeting May 26th. We're going to meet at 11 p.m. at the Oyo Hotel. Look us up on our Facebook and our WhatsApp, on our website, www.faithandpower.online. You will be blessed. Pick up a copy of my new books, Assertive Initiative, Gracing Favor. Those books will change your life. Jesus is Lord. God bless you. Hi, this is Dr. Toby, your host on Health and Wellness. Thank you for joining us. Don't touch that dial. We have a great show, and I mean a great show this week. We have one of the major pillars of organ replacement and organ recovery in the state of Mississippi with us. It's the Mississippi Organ Recovery Association. Ms. Belinda Lane is one of the community outreach coordinators, and we're going to be talking about organs, donations, transplants, recovery, how you and I can be a blessing to the people we see every day who need one of these organs. So what a delight, what an honor to have on the show with me today, Ms. Belinda Lane. You're welcome, ma'am.
Thank you.
Real pleasure having you on the show.
It's a pleasure being here.
Thank you for coming all the way from Flowood, Mississippi. That's where
Yes.
the head office is. And we're going to put the address on the screen for those of you who want to contact the Mississippi Organ Recovery, called MORA for short. Let us know. So tell us a bit about MORA. When was it formed, and what is it all about, really?
So the Mora came to play several years ago, many years ago, back in the 90s. And Mora is definitely designed to be able to help people outlive themselves. And when we say that, we're referring to the fact that if you can be an organ donor, you will help someone else be able to live. And so that's a part of our mission, is to be able to donate organs that will be able to save other people's lives.
How long have you guys been in operation?
So we've been in operation now since the early 90s.
Okay.
And so we were in a location in the Jackson area and started to expand. So after that expansion, we moved to Lakeland Drive, and now we are serving all over the state of Mississippi. So we actually have staff that is located in almost every area of the state.
So like the North, you have an office there?
So we don't have offices there necessarily, but we do have staff who support those hospitals in those areas. For instance, even though we don't have another office in the state, we have staff who is on the coast. We have staff in central Mississippi, South Mississippi, East and West, and we go far north, but we do not cover areas like Tunica, South Haven, Oxford. Those areas are covered by Mid-South Transplant.
Okay, which is out of Memphis?
Right.
Okay. Talk to me a bit. Walk us through the process if an organ donor dies and you guys get the call from time ground zero, or let's say 00 hours. What is the process like?
So let's say, for instance, someone has a stroke, they suffer from a stroke, and we realize that death is imminent. So when death is imminent, we have family care staff. They're usually social workers, and so those family care staff will go to the family at the hospital, and they will ask if that person would like their family member to be an organ donor if they're not registered already. Now, let me just say this. If you are a registered donor, that means that you likely have in the state of Mississippi the Little Red Heart on your license. Some people don't have the license, but yet they are registered donors. But that information is kept in a huge Excel file by UNOS. And so once that family care staff goes to the family and they ask if that family member can be a donor, if the family says yes, then that person will remain on a ventilator. And also, there are three things that happen when a person is possible for donation. One of those things is that the person must be brain dead, of course. That person must be in the hospital, and the person must be kept on a ventilator. And that's in order that the organs will receive oxygen and blood flow.
So who calls you guys when this incident happens?
So the hospitals will contact us and let us know that death is imminent for that particular person. And so that's how that relationship kind of merges. And once that happens, like I said, the family care staff will go and they will speak with the family. Now, if a person is 15 to 18 years old, if they're under 18, we need parental permission. If that person is 18 or over, then we will not need parental permission if that person has the Little Red Heart on their license and they're a registered donor, because that's a binding contract.
If they don't have the Little Red Heart and you reach to their family members and the family member says, okay, does that make it a suitable organ donor?
Yes, absolutely. And then the donor is taken to our facility to be able to procure those particular organs. And so then afterwards, that family member that body is released to the funeral home.
I thought they harvest the organs in the hospital.
In some instances, they will, not all, but in most instances, about 90% of our organs that are donated in Mississippi are actually procured in our office.
That means driving all the way from Hattiesburg to Flowood?
Yes.
Oh, wow.
In some instances,
Okay,
yes.
interesting. Because I know there's a lot of the time is of essence in that kind of issue.
Right, which is why that person is kept on a ventilator.
On a ventilator. Oh, okay. Give us a little background to tissue and organ transplant. I know we use those words transplant liberally, but in your world, there seems to be a difference, right?
Well, when I am actually presenting, I like to say organ, eye, and tissue donation. And so a lot of times people know quite a bit about the organ piece, but they are not aware of the eye and tissue. So when we say eye, we're actually talking about the cornea. Everyone is born with a very clear, thin lens in their eye that's very much like a contact lens. So that cornea allows others to be able to see. So that can be shared or donated to someone for sight. As a matter of fact, yesterday I was out doing a presentation and I met someone who received a cornea transplant.
Wow.
Yes, and so she talked about how this has changed her life drastically and how much this has impacted her and how people just don't know until they are actually going through these things themselves.
Right. And I know there's cochlear implants and then there's cartilage. Then the big ones like you and I talked about earlier is the heart, the kidneys, the liver.
Yes.
And sometimes intestine. I don't know if we do intestines in
We do.
Mississippi. We do that? Okay.
Well, not in Mississippi,
Okay.
we don't, but it can be done.
Right.
And so one of those other things that people are not aware of is that a lot of times folks who are in sports or military, they receive ACL quite often, and people are not aware of that ACL can be donated as well.
Yeah. The ligament. So you have cochlears, you have cornea transplants, you have cartilage, you have kidneys, you have heart, you have lungs, you have intestines.
And tissue.
And
So,
tissue.
so yes, so as I said earlier, a lot of times I like to share that we're talking about organ, eye, and tissue.
Organ, eye, and
And
tissue. Right?
so with tissue, that comes from helping folks who may need skin graft, folks who've been severely burned. Also, another portion of that is that a lot of times women who have breast cancer, they receive reconstructive surgery. So a lot of times they will require additional tissue. So that's how we pair with folks who are who've had breast cancer. So
Okay.
yes, and a
Wow.
lot of people don't know that. They don't realize
Mm.
that. I was actually at a store yesterday where women receive breast cancer, have breast cancer and receive the surgery, and need additional underwear as a result of the surgery. So I was sharing that with the store owner, and she said, "I didn't know that." And I
Wow.
said, "Yes, that's absolutely amazing how far tissue will
Tissue
actually
technology
go
has
to
gone.
impact lives."
That's right. I know you may not be aware of this, but before the days of UNOS and MORA, how did people get transplant? We know the first heart attempted lung transplant and heart transplant was at the University of Mississippi by Dr. Hardy in the 1960s or early 70s. So people were doing transplants in the 60s and 70s, but obviously it wasn't organized as it is today, right?
Absolutely not. And as I'm told that it was going on even before then, of course, but now it's a very organized situation. We have 58 uh, OPOs in the United States, and when I say OPOs, I'm referring to organ recovery
Mm-hmm.
organizations. We are MORA, Mississippi Organ Recovery Agency. We're the only one in Mississippi. And as you said, it is very well organized and very
Organized.
well structured. A
Hmm.
very much a very well oiled machine, we'd like to say.
Right.
And
So you guys are all connected through UNOS, is that correct? UNOS is like an umbrella that gives you some information when you need it.
absolutely, so they are our go-to for finding out who will actually be a donor. As I said earlier, when we are placing those organ donors in that Excel list, it goes straight to UNOS. So when
Mm.
people register to become an organ donor at their driver's license stations or their local DMVs, then their information goes directly to UNOS.
I had a patient here in Louisiana when I worked here as the medical director of FQHC, and he got a call from Tennessee that he had an organ, and he lived in Arcadia, which is about an hour and a half from here towards Shreveport. And they sent a private jet to the Ruston airport, picked him up, took him to Nashville, and he got the transplant. So how does MORA, Mississippi Organ Recovery Agency, work with other states? I mean, this guy was not even in Tennessee, but he got a transplant donor outside the state of outside the state of Louisiana.
So once you're registered, of course, and every case is going to be different. There is not
He was through the VA.
yeah, so every case is going to be different for sure. But once your name is placed, usually there's about three placements, I believe. And so once those placements are received, and sometimes even outside of that, there may be a situation where there are some viable lungs available and someone is in need of a lung. And so if that person is within a proximity of where they can be able to get those life-saving organs, then it just kind of happens that way sometimes. So
Mhm.
you never know in these instances when death is going to occur or when an organ donor is going to be available to actually provide those life-saving
My
organs.
question for you, Belinda, is have you ever had a case where you had a patient who was dying and that patient's organ was harvested and sent to New Orleans, sent to Shreveport, sent outside the state?
Oh, absolutely. Those kind of things happen all the time. So the organs are procured. We like to use the word procured.
Procured. Okay.
We procure the organs in our facility, and then they're shipped out where they are needed.
Okay.
Mhm.
So you're not limited to just Mississippi patients, if I may
No,
use that word.
no, we're not limited.
So how do I know where I am on the list of transplant recipients? I mean,
So
is it a national list?
it is a national list, but you're going to be working with someone directly in your doctor's offices. Uh, so they will help in terms of the placement.
Mm,
We're not necessarily the ones that are doing the
doing that.
placement.
Right.
So, it's not always, we can't determine who's
Hmm.
going to receive which organs and when.
That's a phenomenal. Tell me a bit about deceased and living organ donors.
Okay.
That's another demarcation. We have eye organ tissue, and then now we have deceased and living organ donors.
Deceased and living donors. So here's the thing, if you are a living donor, this simply means that you have a loved one or a friend, or it can even be a stranger that you want to donate one of your life saving organs to, because you can live with one kidney, you can live with one lung, a portion of your intestine, a portion of your liver. And so a lot of times people find that they have a family member or loved ones who are in need of a life saving organ. If that person is a perfect match, the living donor can then donate one of their life saving organs. So, this is something that happens all the time. Um, and people will start usually with their family members. But as I said, in some cases, it can even be a family friend or a perfect stranger. Sometimes there are strangers who say, "Hey, I want to be a lifesaver to someone else in need," and they will then donate those organs to that family, to that friend or family member.
And it must not be transactional, right?
No, of
It must
course
not
not.
be
This is
transactional.
There's no transactions involved. No.
Right. That means money must not exchange hands. The person giving must do it voluntarily,
Right,
not compulsively.
right.
Because we've heard stories of people who became slaves to others who were forced to give their kidneys, not in
Not
America,
in America,
but
not in the
outside the
United States
United
at all.
States. And that has, you know, taken them to court and they've gone to jail because it was transactional instead of voluntary. So I
Well,
just want to make
that's
sure that's clear.
yeah. So yes, please be aware that those things happen often. We have people who are in dire need, and there are folks who want to be able to be a blessing to someone else, and so they decide that they're going to help. But
Mm,
then the other part of that is that you asked me about being a deceased donor.
mm.
So the deceased donor is someone who, as I said earlier, in which death is imminent, which means that they are brain dead already and they're not going to be coming back. They will not have any life left in them at all. It's certainly different than being in a coma. And so, if you're a deceased donor, this is usually the case for deceased donors. And that particular person, uh, in many instances, a deceased donor can donate up to 8 life-saving organs. They can impact over 75 lives with tissue, and they can impact 2 lives with eye cornea.
Wow. So we live in a world where a lot of hospitals are currently distressed and doctors are burnt out, nurses are quitting the job.
Mhm.
How has Mora gone through the pandemic, COVID, in the last 3 years? Has it affected the transplant list? Has it affected the donor list? Have you found you don't have as many, or do you have less collaborating hospitals? Has COVID changed anything in your terrain in the last 3 years?
Well, it did change some things for a while because, of course, if you were a registered donor and you passed away from COVID, we could not accept those particular organs. And so it has just become here a few months ago that a COVID patient can be a donor and with everything except for lungs. So,
Right.
yes, it did have a huge impact on donation. But at the same time, during COVID, our numbers for registration went way up.
Oh wow.
Yeah.
Wow. Wow. So this is interesting because I see that COVID, there were some criterias for being a donor. I know in the past there was restrictions on hepatitis, HIV. I'm sure some of those have changed in the last few years,
Yeah.
you know.
So, for instance, it was initially that if you were an HIV person, you could not be a donor. Now, the restrictions have changed from that because if you are HIV, then you can be a donor to another HIV person.
How about
So,
hepatitis?
so that has not changed.
Okay.
But with the HIV restrictions, that
Restrictions,
is very, very helpful to
very helpful.
someone who is in need of a life saving organ and they have been tested HIV positive.
So Mora is part of a ecosystem. They're not a lone ranger. You guys work with the Department of Health, the hospitals. Am I correct? The physicians.
Absolutely.
You are because whenever I go for my doctor meetings, Mora has a table.
Yeah.
So, so tell us, who does Mora collaborate with?
we,
Who
I like,
funds Mora?
well, we're funded through tissue and OPOs across the United States through um, the
Federal grant.
Yeah,
Okay.
federals, and we're nonprofit, of course, but let me just say that we're out there trying to be boots on the ground to share out information in any way that we possibly can. Therefore, we try and make partnerships in the communities around us, whether it be hospitals. For instance, I'm a community outreach coordinator, which means that I'm in every entity that there is across the community in cities, trying to share out our information. For instance, yesterday I was at a health fair. I was
Mm.
at two schools
Wow.
yesterday, and we're out there trying to be boots on the ground to let people know that it's okay to
To
be
be
a
an organ
registered
donor.
donor. We have so many myths in the communities about organ donation. So we want to certainly debunk those myths and let people know that it's okay to make sure that after you've gone on, that you can let someone else live through
Live.
you.
That's right. That's right. Yeah. So these organs are transported. The way you use it is they're procured and then they're shipped. I love the way you said the word shipped.
Yes.
Now, does Mora own private jets that fly these organs where they're needed? How does that work? The logistics, the cost, the finances, the airplane pilots. How, I mean, you don't just get a plane the minute you want it because you have an organ.
We don't own private jets, but we have access to the things that we need for life saving measures. Now, some of the portion that you're talking about would be business office details that
Right, right,
I'm
right.
unable to answer. So I'll be blatantly honest with you and tell you that those are things that are above what I
Hmm.
understand at Mora. Um, but we
Hmm.
do try and make sure that we can save a life in any way that we possibly can.
So we've spent 90% of our time talking about the donors. Let's talk about the recipients.
Okay.
Who is a suitable recipient? Is there an age catch?
Absolutely not.
Is
I
there
I like
sex,
to.
religious? Is there any age limit, or is there a health limit? I mean, what? Who is a candidate for?
So I like to share with people that you can be a donor if you're 0 to 101. It does not matter about your age. A lot of times I see people and they say, "Oh, you don't want anything that I have," and I say, "How do you determine that?" So if unless you are a medical doctor like you, and everyone is not, then you cannot determine whether or not you are suitable to be a donor.
Mm,
So I just say to them, listen, the only thing you can do is register and sign up. And once you are in a position, if you're in a position to be able to be a donor,
mm.
because that's a if. And the reason I say that is because only 3 out of 1,000 people will pass away in a way that they can actually be a donor.
Oh wow,
Yeah. So that's why we need so many
so
folks to
many folks,
register.
right? tell us a bit about the transplant centers you know in the Mississippi area.
So that is another thing that I don't do as much,
Okay.
but I will say that as far as transplantation, we work closely with our neighboring states, for
Mm-hmm.
instance, Alabama, Louisiana, all of our neighboring states to make sure that those
Those
transplants
plants
are
are
made
available.
as necessary.
Wow. So the university, I know I work at the University of Mississippi Medical Center, so I know we have a very active, we just did our 400th, if I remember correctly, kidney transplant, I
Yes,
think this month or so. So that's a very active program, and you can imagine the joy of a man or a woman who's been on dialysis thrice a week getting a transplant. And I have patients, I have church members. I mean, I'm a living witness of a young man who's 30 something who was, lupus nephritis, and he was on dialysis. And then one day he got a call, a young child died, and he took the kidney of a baby. I don't know if they released the age of the child. The person, did they do that? How did he know it was a baby? I know you don't know the identity, but can you know the age of the donor?
sometimes you can,
Sometimes,
and the
okay.
reason that I say that is because the other day I was with a gentleman from the Natchez area, and he received the kidney and pancreas from an 18-year-old donor.
Oh,
Yes,
wow.
so
And this young man is my church, and he's gone back to work, father, mother, father of a child, husband of a wife, doing excellent, part of one of the deacons. So transplants save lives. If that
absolutely.
young child who died unfortunately had not donated his kidney or her kidney, this 39-year-old in my church wouldn't be doing what he's doing,
Hmm.
working, taking care of his family, and being a useful member of society.
Yes.
So those are life-giving testimony, and I can assure you, the family of that child, I'm sure they look back and say, "Well, we lost our child, but we're grateful that someone else is enjoying their father because we gave this gift."
And as we talk about transplantation, we also should know that transplantation has gone far beyond organs and eye and tissue. We actually, in 2015, in Pittsburgh, there was a young man by the name of Zion Harvey who received the very first pediatric hands transplant.
Hmm.
And the reason I share that too is because this is National Pediatric Transplant Week.
Oh,
And so in 2015, he received hands. And
mm,
so that's something that, it's very
invaluable.
new.
Yeah,
Right,
yeah.
it's very new, but look at how useful these hands will be as this child has grown over the years. And they were designed so that the platelets would grow with him and his
Mm.
hands would grow with him. Because he was 9 years old at the time, and he's about 17, 18 years
Wow.
old now. So, yeah,
And we now do face transplants too.
absolutely.
Belinda is going to be back on the show. Don't miss it. She has a ton of information for you. Don't forget, Jesus is Lord. God bless you.